Lydia was a planned delivery. She was scheduled to be born on April 14th, and we went to Halifax Regional. Dr. True was our doctor, and everything was perfect, you know, and then everything went into a tailspin.
They said that her lungs weren't developed all the way through, and that she needed a special medicine in the hospital. The only hospital closest around was in Lynchburg. So they told us that they had already called the ambulance and that it was on the way.
So when a call comes in for a critically ill infant, we have people, a nurse, a respiratory therapist, and a paramedic on call 24 hours a day, 7 days a week. So they're not always in the hospital, but they all are within a few minutes. They all come to the hospital, and we roll the ambulance with those 3 people and go to Halifax, Southside, wherever we're needed.
They said once the ambulance got there, they would have the medicine that they would put into her lungs and help her out. And they said once they got there, they were going to take her back to Lynchburg.
So when we got there, Lydia had what's known as respiratory distress syndrome, where she needed surfactant into her lungs. So she needed a special tube. It's called intubating, putting a tube into her trachea and giving her surfactant into her lungs to make it easier for her to breathe. She was working very, very hard to breathe, and we were able to give her that medication and make it really easy for her to breathe.
So it was Vicki herself who had administered the surfactant and intubated, I guess, and then the respiratory therapist and the training respiratory therapist. And they brought her in, and of course I was a wreck. His mother took a video. I still to this day cannot watch that video because you can hear her crying. It's the most distressing thing to me as a mother to hear, because it's not normal, it's not natural.
The Children's Medical Network provides funding for our truck and for a lot of our equipment that we use. Some of the equipment that we use would not be possible if it wasn't for the funding provided by Children's Medical Network. We're very grateful for all the things they do for us.
I don't really think words can express, how grateful I was. Because I was in a hospital bed and I couldn't do anything. But on the flip side of that, I was unbelievably grateful, because knowing what I knew about how poorly she was doing with her breathing, and then to see her in the incubator, she was very calm and she was breathing better. It was very soothing to know that she was going to be well taken care of, and gotten there very quickly.
They said that with the ambulance they had everything that they needed to take her, and that it was essentially the same thing that they had up there in Lynchburg. It was just a mobile unit.
So when people ask what CNN does for you?
And they did her for us.
This, 100%. You're in the depths of despair and you think your world is crumbling, and Children's Miracle Network was able to, be the catalyst, provide that vehicle for her to get where she needed to get ASAP to get the care that she needed.